101. A patient taking furosemide reports muscle weakness. Which lab value should the nurse review first? 1. Sodium. 2. Potassium. 3. Calcium. Answer: potassium. Explanation: furosemide is a loop diuretic that can cause hypokalemia, leading to muscle weakness and cardiac dysrhythmias. 102. A nurse is administering an opioid to a postoperative patient. What assessment is most important before giving the dose? 1. Pain score. 2. Bowel sounds. 3. Respiratory rate. Answer: respiratory rate. Explanation: opioids can cause respiratory depression. The nurse must assess for adequate respiratory function before administration. 103. A patient receiving enalapril develops a dry, persistent cough. What is the nurse's best action? 1. Instruct the patient to drink water. 2. Notify the provider. 3. Give an antihistamine. Answer: notify the provider. Explanation: a dry cough is a common side effect of ACE inhibitors like enalapril. The provider may switch to an ARB. 104. A nurse is teaching about nitroglycerin tablets. Which statement by the patient requires follow-up? 1. I keep the tablets in a glass bottle. 2. I take 1 tablet every 5 minutes if I have chest pain. 3. I chew the tablets when I have chest pain. Answer: I chew the tablets when I have chest pain. Explanation: nitroglycerin sublingual tablets should be placed under the tongue, not chewed, to ensure rapid absorption. 105. A patient is started on haloperidol. Which side effect is most concerning? 1. Drowsiness. 2. Muscle stiffness and fever. 3. Dry mouth. Answer: muscle stiffness and fever. Explanation: these are signs of neuroleptic malignant syndrome, NMS, a life-threatening reaction to antipsychotics. 106. A patient taking spironolactone has a potassium level of 5.8 milliequivalent/L. What is the nurse's priority? 1. Document the result. 2. Encourage potassium-rich foods. 3. Hold the medication and notify the provider. Answer: hold the medication and notify the provider. Explanation: spironolactone is a potassium-sparing diuretic. Hyperkalemia is a serious complication and requires immediate attention. 107. A nurse is teaching a patient about using a metered dose inhaler with albuterol. Which statement shows understanding? 1. I exhale fully before using it. 2. I breathe in through my nose. 3. I use it right after my corticosteroid inhaler. Answer: I exhale fully before using it. Explanation: proper use includes exhaling completely before inhaling the medication to allow full delivery into the lungs. 108. A patient taking levothyroxine reports feeling jittery and anxious. What is the nurse's priority action? 1. Reassure the patient. 2. Ask about dose adherence. 3. Notify the provider. Answer: notify the provider. Explanation: jitteriness and anxiety may indicate overmedication with levothyroxine, suggesting possible hyperthyroidism. 109. A nurse is reviewing medications for a patient with chronic kidney disease. Which medication order should the nurse question? 1. Acetaminophen. 2. Ibuprofen. 3. Calcium carbonate. Answer: ibuprofen. Explanation: NSAIDs like ibuprofen can worsen renal function and should be avoided in patients with kidney disease. 110. A patient is prescribed heparin and develops hematuria. What is the nurse's best action? 1. Continue the infusion. 2. Stop the infusion and notify the provider. 3. Administer vitamin K. Answer: stop the infusion and notify the provider. Explanation: hematuria may indicate bleeding due to heparin. The nurse must stop the infusion and notify the provider. 111. A nurse is teaching about subcutaneous insulin injections. What statement indicates correct understanding? 1. I'll inject in the same spot each time. 2. I will rotate sites with each dose. 3. I'll use my thigh only. Answer: I will rotate sites with each dose. Explanation: Rotating injection sites prevents lipodystrophy and improves absorption of insulin. 112. A patient on warfarin has an INR of 5.2. What is the nurse's priority action? 1. Give the next dose. 2. Hold the dose and notify the provider. 3. Administer heparin. Answer. Hold the dose and notify the provider. Explanation. An INR of 5.2 is above the therapeutic range and increases bleeding risk. The provider must be informed. 113. A nurse is administering methotrexate. What is the priority teaching? 1. Take with vitamin C. 2. Avoid pregnancy while taking this medication. 3. Increase fluid intake at bedtime. Answer. Avoid pregnancy while taking this medication. Explanation. Methotrexate is teratogenic and contraindicated in pregnancy due to the risk of fetal harm. 114. A patient is prescribed clonidine for hypertension. What is the nurse's teaching priority? 1. Avoid sudden withdrawal of the medication. 2. Take with meals. 3. Increase potassium intake. Answer. Avoid sudden withdrawal of the medication. Explanation. Abrupt discontinuation of clonidine can cause rebound hypertension, which can be severe. 115. A nurse is preparing to administer sublingual nitroglycerin. The patient's BP is 86/60 millimeter of mercury. What is the appropriate action? 1. Administer the medication. 2. Hold the medication and notify the provider. 3. Raise the head of the bed. Answer. Hold the medication and notify the provider. Explanation. Nitroglycerin lowers blood pressure. It should not be administered when hypotension is present. 116. A nurse is reviewing medications with a patient newly diagnosed with tuberculosis. Which medication should be included? 1. Metronidazole. 2. Rifampin. 3. Azithromycin. Answer. Rifampin. Explanation. Rifampin is a first-line drug in tuberculosis treatment. It inhibits RNA synthesis in Mycobacterium tuberculosis. 117. A patient reports seeing halos around lights while taking digoxin. What should the nurse do first? 1. Document the finding. 2. Hold the dose and notify the provider. 3. Check the patient's visual acuity. Answer. Hold the dose and notify the provider. Explanation. Halos are a classic sign of digoxin toxicity, requiring immediate evaluation and intervention. 118. A nurse is caring for a patient on amphotericin B. What is the priority lab to monitor? 1. White blood cell count. 2. Creatinine. 3. Hemoglobin. Answer. Creatinine. Explanation. Amphotericin B is nephrotoxic. Renal function must be closely monitored during therapy. 119. A patient is prescribed a beta blocker. Which finding would require the nurse to hold the medication? 1. Heart rate 52 BPM. 2. BP 128/78 mmHg. 3. Respiration 16 per minute. Answer. Heart rate 52 BPM. Explanation. Beta blockers slow the heart rate. A rate below 60 BPM is a common threshold for holding the dose. 120. A patient taking isosorbide mononitrate reports a headache. What should the nurse advise? 1. Stop taking the medication. 2. Take with food. 3. Take acetaminophen as needed. Answer. Take acetaminophen as needed. Explanation. Headaches are a common side effect of nitrates. Acetaminophen is typically effective in managing them. 121. A patient is started on lithium therapy. Which lab results should be monitored closely? 1. Sodium. 2. Calcium. 3. Magnesium. Answer. Sodium. Explanation. Sodium levels affect lithium excretion. Low sodium can lead to lithium toxicity. 122. A nurse is teaching a patient prescribed phenytoin. Which statement requires follow-up? 1. I'll brush my teeth regularly. 2. I can stop the medication if I feel well. 3. I'll take the medication at the same time each day. Answer. I can stop the medication if I feel well. Explanation. Abruptly stopping phenytoin can trigger seizures. Adherence is critical. 123. A patient receiving gentamicin 4 reports ringing in the ears. What is the nurse's best action? 1. Reassure the patient. 2. Slow the infusion. 3. Stop the medication and notify the provider. Answer. Stop the medication and notify the provider. Explanation. Ototoxicity is a serious side effect of aminoglycosides like gentamicin. 124. A patient taking metformin reports upcoming imaging with contrast. What is the nurse's priority action? 1. Continue metformin. 2. Hold metformin before and after the test. 3. Increase fluid intake. Answer. Hold metformin before and after the test. Explanation. Metformin should be held to prevent lactic acidosis associated with for contrast. 125. A nurse is educating a patient on ferrous sulfate. Which instruction is appropriate? 1. Take with milk. 2. Take with vitamin C. 3. Take before bedtime. Answer. Take with vitamin C. Explanation. Vitamin C enhances the absorption of iron supplements like ferrous sulfate. 126. A patient prescribed morphine for has a respiratory rate of 8 per minute. What is the nurse's priority action? 1. Reassess in 30 minutes. 2. Administer naloxone. 3. Elevate the head of the bed. Answer. Administer naloxone. Explanation. Naloxone is the antidote for opioid-induced respiratory depression. Immediate action is required. 127. A nurse is caring for a patient taking isoniazid. Which lab value is a priority to monitor? 1. Liver enzymes. 2. White blood cells. 3. Hemoglobin. Answer. Liver enzymes. Explanation. Isoniazid is hepatotoxic. Liver function tests must be monitored regularly. 128. A patient on prednisone reports black, tarry stools. What is the nurse's best response? 1. Document the finding. 2. Encourage more fiber. 3. Notify the provider immediately. Answer. Notify the provider immediately. Explanation. Black, tarry stools may indicate GI bleeding, a serious complication of corticosteroid use. 129. A patient is prescribed tamsulosin. What teaching is essential? 1. Change position slowly. 2. Take before bedtime. 3. Avoid dairy products. Answer. Change position slowly. Explanation. Tamsulosin can cause orthostatic hypotension. Patients should be instructed to rise slowly. 130. A nurse is administering vancomycin 4. The patient develops flushing and hypotension. What is the likely cause? 1. Allergic reaction. 2. Red man syndrome. 3. Septic shock. Answer. Red man syndrome. Explanation. Rapid infusion of vancomycin can cause histamine release, leading to red man syndrome. 131. A nurse is educating a patient prescribed alendronate. Which statement requires correction? 1. I'll take it first thing in the morning. 2. I'll lie down for 30 minutes after taking it. 3. I'll take it with a full glass of water. Answer. I'll lie down for 30 minutes after taking it. Explanation. Patients must remain upright for at least 30 minutes after alendronate to prevent esophageal irritation. 132. A patient taking levodopa-carbidopa reports new involuntary movements. What is the nurse's best action? 1. Encourage ambulation. 2. Hold the dose and notify the provider. 3. Reassure the patient. Answer. Hold the dose and notify the provider. Explanation. Involuntary movements can be a sign of toxicity or overdose with Parkinson's medications. 133. A patient taking sulfonylureas is found diaphoretic and confused. What is the likely cause? 1. Hyperglycemia. 2. Hypoglycemia. 3. Hyponatremia. Answer. Hypoglycemia. Explanation. Sulfonylureas can cause hypoglycemia, especially if the patient skips meals. 134. A patient is prescribed digoxin. Which heart rate should prompt the nurse to withhold the dose? 1. 90 bpm. 2. 72 bpm. 3. 56 bpm. Answer. 56 bpm. Explanation. Digoxin is withheld if the apical heart rate is below 60 bpm to prevent bradycardia. 135. A nurse is teaching a patient about atorvastatin. What symptoms should be reported immediately? 1. Headache. 2. Muscle pain. 3. Constipation. Answer. Muscle pain. Explanation. Statins can cause rhabdomyolysis, a serious condition involving muscle breakdown. 136. A patient asks why they need to avoid grapefruit juice with their medication. What is the best explanation? 1. It increases the effectiveness. 2. It can cause serious side effects. 3. It has no real effect. Answer. It can cause serious side effects. Explanation. Grapefruit juice can inhibit drug metabolism and increase drug levels to toxic ranges. 137. A nurse is administering a calcium channel blocker. What side effect should be monitored? 1. Hypertension. 2. Bradycardia. 3. Insomnia. Answer. Bradycardia. Explanation. Calcium channel blockers like verapamil and diltiazem can cause bradycardia. 138. A patient on fluoxetine reports increased energy and suicidal thoughts. What is the nurse's priority? 1. Educate the patient. 2. Notify the provider immediately. 3. Schedule a follow-up visit. Answer. Notify the provider immediately. Explanation. Increased energy with suicidal thoughts may indicate increased suicide risk in early antidepressant use. 139. A nurse is teaching about warfarin therapy. What food should the patient limit? 1. Leafy greens. 2. Milk. 3. Citrus fruits. Answer. Leafy greens. Explanation. Leafy greens are high in vitamin K, which antagonizes the effects of warfarin. 140. A patient on hydrochlorothiazide complains of muscle cramps. What lab result supports the symptom? 1. Hyperkalemia. 2. Hypokalemia. 3. Hypernatremia. Answer. Hypokalemia. Explanation. Thiazide diuretics like hydrochlorothiazide can cause potassium loss, leading to muscle cramps. 141. A patient taking spironolactone reports palpitations and muscle weakness. What is the nurse's priority assessment? 1. Potassium level. 2. Calcium level. 3. Sodium level. Answer. Potassium level. Explanation. Spironolactone is a potassium-sparing diuretic and can cause hyperkalemia, leading to palpitations and weakness. 142. A patient is prescribed rifampin for tuberculosis. What should the nurse include in patient teaching? 1. Your urine may turn orange. 2. Avoid dairy products. 3. Take with antacids. Answer. Your urine may turn orange. Explanation. Rifampin can cause body fluids, urine, sweat, tears, to turn orange, which is harmless, but should be expected. 143. A nurse is monitoring a patient on heparin therapy. Which lab value is most important? 1. INR. 2. Platelet count. 3. APTT. Answer. APTT. Explanation. Activated partial thromboplastin time, APTT, is used to monitor therapeutic response to heparin. 144. A patient is receiving methotrexate for rheumatoid arthritis. Which finding is most concerning? 1. Mild nausea. 2. Bruising. 3. Fatigue after activity. Answer. Bruising. Explanation. Methotrexate can cause bone marrow suppression, increasing bleeding risk indicated by bruising. 145. A nurse is reviewing a prescription for nitroglycerin patches. What is a correct instruction? 1. Apply 1 every 12 hours and remove at night. 2. Apply over the same site daily. 3. Cover with a heating pad for better absorption. Answer. Apply 1 every 12 hours and remove at night. Explanation. A nitrate-free period helps prevent tolerance. Patches should be removed at night. 146. A patient on furosemide therapy has a potassium level of 2.8 milliequivalent/L. What is the most appropriate nursing action? 1. Encourage fluid intake. 2. Hold the next dose and notify the provider. 3. Administer calcium gluconate. Answer: hold the next dose and notify the provider. Explanation: furosemide can cause hypokalemia, and potassium at 2.8 milliequivalent/L is dangerously low. 147. A patient receiving codeine reports difficulty breathing and severe drowsiness. What is the nurse's priority? 1. Provide oxygen. 2. Administer naloxone. 3. Encourage deep breathing. Answer: administer naloxone. Explanation: naloxone reverses opioid toxicity symptoms such as respiratory depression and sedation. 149. A patient is prescribed warfarin. Which over-the-counter medication should be avoided? 1. Acetaminophen. 2. Ibuprofen. 3. Loratadine. Answer: ibuprofen. Explanation: NSAIDs like ibuprofen increase bleeding risk when taken with anticoagulants like warfarin. 150. A nurse is caring for a patient with bipolar disorder, starting valproic acid. Which lab value should be monitored? 1. Liver enzymes. 2. TSH. 3. Potassium. Answer: liver enzymes. Explanation: valproic acid can cause hepatotoxicity. Liver function tests must be routinely monitored.